The Primary Care Nursing Workforce Project was started by the CCG after conversations with all of our general practices, and as a CCG we are trying very hard to integrate our workforce, increasingly finding nurses and GPs and others to work. It's a national problem, but in this area as much as anywhere else is becoming increasingly a problem. And we have some old rules whereby district nurses only look after housebound patients and practice nurses only see patients in the practice. And we wanted to start to break down those organisational barriers and get people to start to work together and use their skills in a way where the practice nurses who are very expert in long-term conditions management like diabetes and COPD could go out and see patients in their own home, and district nurses who are real experts in things like wound care could run clinics within the practice. So the CCG funded each practice an amount of money. In total it was just shy of £500,000 over 2 years to come up with innovative projects that supported the integration of nursing, so that supported the workforce challenge that we have, but also integrated the nursing professions so that they started to care for the frail elderly in more innovative ways.
Previously, practice nurses tended to stay in practice and just see patients that could get there, whereas a lot of practices are now enabling their practice nurses to go out to patients' own homes. And that's important because they do a different job from district nurses. The practice nurses are better geared for dealing with the long-term conditions that these patients have got. So the idea is they'll then get the same standards of care as they get if they were able to come in.
The Primary Care Nursing Workforce Project, we wanted to look at things in a slightly different way, and so what we did is use the funding to support the local voluntary community transport scheme, and we used that scheme to bring patients into the surgery who would have otherwise needed a district nursing visit. We find the scheme works very well, and referrals are sort of triaged by the clinicians, and then we book a bus and it brings the folks down in wheelchairs or however they are able to get down in the buses. It's been benefiting quite a number of ways. Firstly, for the patients, it's benefited them in reducing social isolation. It's brought them into contact with people, other friends that they haven't caught up with for a while in the waiting room. It's allowed them to access other services at the practice, such as seeing the GP, the dispensary. I mean, it's a big practice area. It's about 200 square miles. It's very sparsely populated, and potentially you could spend a great deal of time between each visit just on the drive. So yeah, it would take a long time to do the same amount of work. Having the kind of spare capacity now has allowed us to do other newer projects to help treat people at home. One example is we've done some community intravenous antibiotics. So rather than the patient remaining on the ward at hospital for 6 or 7 weeks, or even going to the hospital as a day case on a daily basis, we're now able to use that nursing time to administer the antibiotics either here at the practice or in the patient's home. So that's much better for the patient, and it keeps the skills and it develops new skills within the nursing team. Olive is a lady in her 80s. She was unfortunate enough to have an infected knee replacement, and that required some quite extensive, powerful antibiotics through a drip. The option she was given was coming back and forth to the hospital each day in Northallerton as a day case, which is a 60-odd mile round trip. She would have had to find someone to take her there every day or rely on hospital transport. She has a disabled husband who lives at home, who she was very keen that she spent the time with him. So because of this sort of situation, we worked alongside our colleagues at the hospital to set up intravenous antibiotics at the practice, and also we did a session for her at home each week.
It was grand. It was fine.
So that would have saved a possible long stay in hospital.
I would have been in hospital 8 weeks. Oh no, it was much easier coming here.
Mm.
Much easier.
One of the major drivers behind this project is that if we can provide better care for the patients who have chronic illnesses at home, they are less likely to end up in hospital, so they benefit, and if they're less likely to end up in hospital, they cost less money, and so the NHS saves.
So in summary, the project has helped us with our workforce challenge by reducing duplication and getting people to work together. It's helping us to integrate different parts of the nursing profession so that they can share skills and can work in different ways. And it's helping us manage our increasing frail elderly population by working with them in their own homes or in the practice, depending on which it's easiest for them to get to and where they are most comfortable being treated.